Hi, I'm here to talk a little bit about bone marrow biopsies in EPIC at Emory. You can do this from many encounters. You can do it from an orders only encounter. You can do it from telehealth. You can do it from a clinic encounter. In a clinic encounter, it'll often be under the plan tab. In an orders only encounter, it's under the treatment tab, and you're looking for a tab called Smart Sets. When you see that, you can type in bone marrow, and bone marrow will get you to the standard bone marrow package here. This bone marrow package, once you open it, has a number of items already pre-selected. This is probably about a 50-click activity for most of our standard bone marrow biopsies. So I suggest to you to create your own smart set and then use that every time for a particular patient. Once you get to this section, you can manage user versions and create a version based on the baseline bone marrow package. We'll call this bone marrow biopsy with MRD, and for me, it'll be mostly myeloma. The first two sections here, lab appointment and procedure appointment request, are required for a bone marrow biopsy that is being performed at a procedure clinic. And there are a number of procedure clinics at Emory. There's one at Clifton. It's open 5 days a week and allows good sedation. There's a procedure clinic at St. Joseph's on Tuesdays and Thursdays, Johns Creek on Wednesday, and the Decatur procedure clinic should open in end of April, early May of 2023. You can see there are also procedure appointment requests for a bone marrow biopsy done under interventional or CT guidance, and that's often an option really at St. Joe's and potentially Johns Creek, and I don't have access to doing that very much. So usually I send the procedure appointment request and the lab appointment request to a procedure clinic, either at Clifton, Midtown, St. Joe's, or Johns Creek. Then there's the bone marrow biopsy exam and bone marrow aspirate differential. And then comes the many clicks. So flow cytometry is often done to look for clonality. Again, I oftentimes answer every question I can, and it's not always a perfect answer. But I'm hoping that some of these labs are going to take a positive spin on this, as I'm trying to use these orders for every myeloma patient I see. So here we've identified the flow cytometry, and then I often use karyotyping. Again, they ask other questions because they're concerned about using these to assess chimerisms after allogeneic transplant, and we haven't done allogeneic transplants for myeloma very often. Again, try to answer every field possible, and you can see that's listed here. I oftentimes do a fish panel as well. Again, trying to answer every field possible. And then there are a number of molecular tests and referrals that are uncommon with patients with myeloma, but certainly with other heme malignancies. clonoSEQ, use it for minimal residual disease, is pretty common, and almost everything here is filled out. So here I have all my basic orders. I would save it under a bone marrow biopsy with plus MRD, let's say. Oops. Getting the right name, because I've done this video a few times. Close this down, and here I'm going to replace all the things I did so I can see all the items here. Now, the two areas we sometimes mess up is we don't put appropriate dates. So here you can use edit multiple, choose all the bone marrow biopsy procedures, and do an expected date. These are all going to happen next week, approximately, and definitely going to happen by the end of the month. You hit accept and it applies those dates to all of these orders. You then can sign. After appropriately associating all these orders with a problem. Lastly, you want to route these orders to the right people. So into the routing section, the list here is P. Clifton C. Plaza, and then here it's EUHM admin, not the infusion admin. And that exact pool is not available in this proof of concept environment I'm using now. But here you use a particular scheduler pool and you tell them, please schedule bone marrow biopsy next week. At this spot, you route this to the patient, hit send, and your bone marrow biopsy is heading off to the schedulers to make it official. Thank you so much.